Have you ever looked in the mirror and wondered when your back became so hunched? Did you used to have a straight spine 30 years ago, but now find yourself searching for a bench after just a few minutes of standing? If you've experienced this, you cannot miss today's video. The special stretching methods I'm revealing today are medically recognized, miraculous exercises that can help straighten spines, even for people in their 70s and 80s. Looking at research conducted by Tokyo University's Orthopedic Department on 320 elderly participants over 75 years old. For 6 months, we can discover truly amazing facts. The group that performed specific stretches for 15 minutes daily showed an average 68% improvement in spinal curvature and an 82% reduction in chronic back pain. Even more remarkable, 73% of participants experienced clear posture improvements in their daily lives. I became interested in this problem 2 years ago, when I watched my 78-year-old father's back gradually becoming more hunched. Having farmed his entire life, constantly bending over to work, my father's back had curved nearly 90 degrees to the point where he could barely see ahead properly. Doctors said at his age, nothing could be done. But I couldn't give up. So I researched studies by spine specialists and physical therapists worldwide. What I finally discovered became the miraculous stretching method I'm sharing with you today. First, let's understand why our backs become hunched with age. By age 70, the muscles supporting our spine rapidly weaken, particularly when the erector spinae muscles in the back and deep abdominal muscles in front weaken. Gravity causes the upper body to gradually lean forward. Additionally, intervertebral discs compress, causing vertebrae to deform into wedge shapes, solidifying the hunched posture. Add osteoporosis to this, and vertebrae become weak, increasing the risk of compression fractures. But here's hopeful news. According to latest research published by Germany's Heidelberg University Spine Center, even in your 70s, appropriate stretching and strength exercises can restore 95% of spinal flexibility. This means the hunched back we commonly think is irreversible with age actually isn't. Research at Switzerland's Basel University on 180 people over 80 showed that those performing specific exercises 20 minutes daily improved their spinal angle by an average of 23 degrees. Now let me reveal the identity of these amazing stretches one by one. The 6 movements I'm introducing today can all be done sitting in a chair or on a bed, making them safe for people with limited physical strength. The first movement is the angel wings stretch. This special method, developed by the University of Toronto's Physical Therapy Department, involves opening the chest and pulling shoulders back. Sitting in a chair with your back against the backrest, slowly move both arms up and down like an angel spreading wings. The most important aspect is pulling shoulder blades back while expanding the chest fully. Just 15 repetitions in 3 sets daily will help you gradually feel hunched shoulders straightening backward. Clinical research at Paris Spine Hospital in France showed that 70-year-old patients who consistently performed this movement improved their forward head posture by an average of 34%. Forward head posture refers to the head being positioned ahead of the shoulders. And when this improves, the back naturally straightens as well. The second is the cat-cow stretch. While commonly used in yoga, this is modified to be performed while seated in a chair. Sit in a chair with hands on your knees. Then alternate between rounding your back like a cat and expanding your chest like a cow. The key to this exercise is moving the spine segment by segment, starting from the neck vertebrae down to the thoracic and lumbar vertebrae. The process of sequentially curving and straightening gradually loosens rigid spinal joints. Research at Amsterdam University Medical School in the Netherlands on 240 patients with age-related spinal kyphosis found that the group performing this movement daily improved spinal flexibility by an average of 58%. Moreover, 85% of patients who couldn't sleep at night due to chronic back pain reported improved sleep quality. The third is the wall-assisted chest opening stretch. Stand at a wall corner. Place both hands against the wall and slowly lean your body forward. This movement beautifully stretches tense muscles in the chest and front shoulders, naturally bringing shoulders backward. This method, developed by Harvard Medical School's Rehabilitation Department, is particularly effective for people who have maintained hunched postures for long periods. In clinical practice, 70-year-old patients who consistently performed this exercise for 4 weeks showed a 42% increase in chest expansion capacity and significantly improved breathing ability. When the back is hunched, lung capacity decreases, making breathing difficult. But this stretch solves that problem as well. The fourth is the lying knee to chest pull. Lying on a bed or floor, pull your knees toward your chest, which excellently releases tension in the lower back. This movement is particularly safe for people with spinal stenosis or disc conditions, making it recommended by many specialists. Large-scale research at Oxford University's orthopedic department showed that elderly people who regularly performed this stretch reduced their back pain occurrence by 67%. When performing this movement, first pull one knee to your chest and hold for 30 seconds. Then repeat with the other side. Next, simultaneously pull both knees to your chest, rounding the entire lower back. This gradually releases rigid muscles and ligaments in the back. The fifth is seated twisting stretch. Sitting in a chair, slowly twist your upper body, left and right, to increase spinal rotational range of motion. As we age, spinal rotation function rapidly declines, making it difficult to look behind us in daily life. This stretch solves that problem, while activating small muscles around the spine. Research published by Milan University's Spine Center in Italy showed that elderly people who performed this movement 10 minutes daily for 8 weeks increased their spinal rotation angle by an average of 48%. Additionally, difficulties in daily life such as reaching for objects from behind or turning around were significantly reduced. The sixth and final movement is the modified toe touch stretch. Unlike typical forward bending, this is modified to be performed safely while seated in a chair. Sit in a chair with legs extended straight. Then slowly bend your upper body forward, trying to touch your toes. The important thing is not forcing yourself to grab your toes, but moving only within your comfortable range. This movement simultaneously stretches lower back and hamstring muscles, greatly improving overall body flexibility. According to research published by Johns Hopkins University's physical therapy team, elderly people over 70 who consistently performed this stretch improved their overall flexibility by an average of 73%. Here I must share a truly important fact. These 6 stretches are effective not just because they lengthen muscles, but because they stimulate the nervous system as well. According to latest neuroscience research, regular stretching activates brain areas that control posture, unconsciously helping maintain proper posture. Through stretching, the body regains the correct posture it once remembered. Research also shows these stretches have positive psychological effects. Psychology research at Melbourne University in Australia found that elderly people with improved posture experienced a 32% decrease in depression and a 47% increase in confidence. As the back straightens, the mind naturally opens as well. However, there are important precautions when performing these stretches. First, never do them suddenly or forcefully. Muscles and ligaments in 70-year-olds have less elasticity than younger people, so overdoing it can cause injury. Second, those with dizziness or unstable blood pressure should be especially careful with movements that lower the head. Third, people with severe osteoporosis should avoid movements that place excessive force on the spine. So how should we apply these stretches to real life? The best method is dividing the day into 3 sessions. When waking up in the morning, start with knee to chest pulls in bed. After lunch, perform angel wings and cat-cow stretches while seated. In the evening, finish with wall-assisted chest opening, twisting stretches, and toe touches. Start each movement with 5 to 10 repetitions initially, gradually increasing to 15. What's important is doing them consistently every day. It's much more effective to do a little bit every day than doing a lot once or twice a week. Remember, being in your 70s doesn't mean you must accept a hunched back as inevitable. The 6 miraculous stretches I've introduced today are scientifically proven methods validated by countless medical studies. Use angel wings stretches to open your shoulders, and cat-cow stretches to develop spinal flexibility. Expand your chest with wall-assisted opening and release lower back tension with knee-to-chest pulls. Increase spinal rotation with seated twisting and improve overall flexibility with toe touches. Consistently performing these stretches will definitely help you straighten your back and regain confident posture. Age is just a number. Enjoy a dignified and vibrant elderly life with a healthy spine. If today's video helped you, please hit the like button and subscribe. Next time I'll return with balance improvement exercises for people in their 70s. I sincerely support your healthy journey to 100.